I read a couple of times El Quijote. I have a book that I bought and when I was in college in Juarez and then El Paso, and I carry it with me, and I have it since be more than 70 years. I think there's a lot to be learned from there, and be crazy enough to follow your dreams. We were crazy like Don Quixote.
My first recollection was I was in grammar school in Roswell, New Mexico, in a game of marbles. You draw a ring in the dirt. And the idea is to knock the other marbles out. You could keep shooting until all the marbles are out of the ring. We're in this game of marbles. There's one kid, a white kid, got mad because we took his marbles. We got in a fist fight. And after we were tired of hitting each other, we both had bloody noises and everything else. He says, "Why don't you go back where you come from?" And what? As far as I knew, that's where I came from. I was born Fernando Luis Flores in Lincoln, New Mexico. Grew up in Lincoln, New Mexico until about 1945. My mother always wanted out of New Mexico, so when the war started, she and my father decided to come and work in the shipyards in San Francisco. When I was 17, I couldn't find a job. Nobody was going to hire a Mexican kid who was 16 or 17 in South San Francisco. So I joined the Navy. Somehow or another, in the Navy, or you join, you sign the papers, and the next thing I know, I'm Luis Fernando Flores. I'm not, trying to change the Navy as a recruit is almost impossible. I met my wife in 1955. She had grown up in Fresno and San Francisco. Driving in the hills and everything else wasn't for her. So I said, well, let's go. And we settled here in Napa.
My name is Placido Garcia. I work for Chato Mantelena for 43 years. I'm a vineyard foreman. We have headlights. You can see everything over there. Plenty of light for the tractors. Harvest in the night time is much better for the picker. We pick, especially with this heat, pick in the daytime before we pick in the daytime. And by 2 o'clock was exhausted. It's hard. It come maybe 25 tons, 30 tons, 2 crews. Sometimes it's difficult when you don't sleep enough.
I came to this country in 1956. When I asked my father if I came over, I had 4 brothers here already. So I want to come over and join it. I remember seeing the Golden Gate Bridge like I never saw anything so beautiful. The fog was half of the towers. Real nice day, very clear, and Jesus Christ, this is beautiful. We passed the bridge, and then we went to Sonoma, and then through Los Carneros. So I fell in love with the whole thing. We arrived in Santa Elena, and I went to my brother, and I said, I'm not going back. He looked at me, what? I'm not going back. Well, what do you mean you're not going back? What are you going to do? I'm going to look for work in here. I'm not going back. I worked for the winery for about 11 or 12 years with the years that I've worked in the vineyard, because it was the Mondavi family. The Mondavi family was very, very good people to us.
When I was at Cal, I had met Cesar Chavez and Bert Corona, who was in the beginnings of the MAPA, Mexican-American Political Association. You can either work within a system and try to change it, or bombard it from out. Which one are you going to do? I says, how about a little of the both? And so that started my involvement with farm workers.
One day they invited me to a meeting in Napa to meet a guy that was talking about politics. Was MAPA, Mexican American Political Association. And Lou was a member of the state board. So when he moved to Napa, he was trying to start a chapter. We had a meeting in his house. And I didn't say too much, I would just listen. But I liked what I was hearing.
We started meeting at Calistoga Center to talk to the workers about the union. I became involved with some people, and we set up Project Head Start. Hope was one of those persons that came to that center.
My father was a farm worker. I'm a farm worker's daughter. I married a farm worker, and I did a lot of work as a farm worker.
She was hired at the Head Start as a teacher assistant, eventually became the director for Project Head Start, became an advisor to the nation Head Start program. And so we all felt pretty good about that.
What it taught me in particular as a parent in that program was that I came to believe that as a Mexican American, I was worth something, because I had been put down since I was a kid in school. Mom would get up early, do her best to put, whatever she could on a piece of tortilla, and would take it to school. We'd hide behind the trees to eat our lunch because the kids would make fun of us. Growing up in that environment is a soul-breaking experience that you don't get over. It hurts. It'll hurt for the rest of our lives.
From Mexico, Chihuahua, Mexico. And I came to the United States in 1960. I was working in other places, migrant worker. And I remember those times, you got sick, it's a big thing for you. So, to go and see a doctor is a big adventure for you. You can think about it before. Why? They don't speak Spanish, you don't speak English. And I come here and make 85 cents an hour. It was you got sick, you don't have enough money to pay the doctor. Señorita, you don't have any right to say anything because you was asking for something, you out.
We set up an operation called Centro de Información y Servicios, Center of Information and Services. The farm workers would come there for services, whatever we could do. And we noticed there was a need for health services. And so originally it was Tala de Winter that was the director of the Centro de Información y Servicios.
Tala was already working at Centro de Información y Servicios in Yountville. The centro was funded by some of the poverty program funds. So that's how I met Tala. At first we were clashing because Tala was Peruvian and she was going to be working with Mexican farm workers. How can that be, you know? And so Tala had to work extra hard for the community to trust her. She became one of the most trusted, respected Latina women in the county.
A friend of mine invited me to go to Hillsborough. They got a clinic over there. I see the clinic. I like it. I am in love with that. I said, we need something like that in Napa to stand up and say, how about a clinic? But the main barrier in that was Tala de Winter. He was the director. She fell in love with that clinic.
We accomplished a lot of things because she was very effective. This is the Centro de Información y Servicios that we opened when we left the Yountville service office. In this corner, we separate one little room to start the La Clínica. We need doctors. We need everything because the space of the clinic was problem this big. And before we know, we have a lot of support. We manage it for as long as we can. And I remember Tala came over and we had a meeting. They said, what are we going to do? A state is not giving us any money. We only have a chance to get somebody else to help us or close the clinic. And we said, no, close it, nothing.
Our winery is located in Napa. The most distinguishing characteristic is Stag's Leap. There was a legend about the hunters who hunted this big deer and he always escaped them. And finally they had him cornered and he got away because he leapt, it's a legend. You can let it have it end any way you want. I came to the Napa Valley in 1973. When I left Chicago, they said, where are you going? I'm going to the Napa Valley. They said, where's that? No one that I knew in Chicago had ever heard of the Napa Valley. It wasn't until 5 or 7 years after I'd arrived that I'd even heard of CommuniCare+OLE. I became very interested, got myself on the board. My goal was to develop a much stronger awareness in the valley, particularly among the vintners, of CommuniCare+OLE and what they did. And gradually, the word got around because we were the only outfit that really focused on the underserved and particularly field workers, but not exclusively the field workers. The hospitals had a lot of money behind them and the clinic didn't. They had about 3 months funding, that's all they could handle. Well, I was on the board and they decided that we ought to have our own building. Pointed to me and said, "Okay, will you take care of that, John?" So then the task was to raise the money. It became all engrossing, but I never borrowed any money. And I raised $9 million. We proceeded to build the building, and in 2002, it was finished, and we dedicated it. We went from 8 exam rooms to 20 exam rooms. And a little later, we added on 6 more rooms. And that's how the present building started. And of course, we thought, well, this will go forever. 2 years ago, they'd filled it all up. So they clearly needed more space, and that was the impetus for the present building, which is being built. It's a new 30,000 square foot building. The property, a half acre, was given to OLE Health by the Gasser Foundation, who owns a lot of that property. They're getting 30,000 patients a year. Isn't that amazing?
When I first came to the Valley, and my husband and I were really thrust into this world where there felt like there were haves and have-nots and not a lot in between. We were not quite sure where we fit because we're not living on an estate somewhere with a vineyard in our backyard. It took a while to figure out where we fit into the spectrum here. I work in early childhood education with little children, 3 to 5-year-olds. I love being with children, and with my own children, and then with the ones I get to teach. So I look forward to getting back there. It's been hard to be away.
Toda mi vida casi yo vendí comida para vender. Yo creo como unos 50 o 55 años vendiendo comida. Ya me iba, pues vendía en México. Cuando yo ya no pude vender, que ya estaba yo ya muy mal de mis rodillas, pues sí, como que me dio tristeza porque yo siento que eso es mi vida. Venía mal de mis rodillas y ya pues entre más y más, ya hasta que ya no podía caminar bien. Aquí en la clínica me dieron un andador y él vio las radiografías y ya cuando me tocó que él me atendiera me dijo, dice, qué mal está su rodilla. Dijo, ya no tiene lo que es nada de cartílago. Todos se movieron en 3 meses. En 3 meses me dijeron que me iban a operar, me dio la cita, dice, le voy a dar su cita para el 7 de febrero. El 7 de febrero me operaron.
I went to a doctor in April, thinking I had one problem. One thing led to another, and I ended up having an emergency surgery like a week or 2 weeks later. And then I got a call after that, and they said that I had leiomyosarcoma, which is a type of cancer, a rare form of uterine cancer. Denial at first. Pretended that it wasn't really happening. And then shortly afterwards, lots of tears. I didn't do it alone. I did it with a lot of help. I'm still doing it with a lot of help. And it's been hard. People say, they're like, oh, you're so brave. And I'm like, I do not feel brave. I just feel like I wake up and I think, okay, what do we need to do today? And then I do that. And so little by little, getting through it.
Ya después que me operaron, me habló el doctor Jorge que quería verme para ver a ver cómo había salido la operación. Y ya vine, ya me vio él, dice, está muy bien, hasta lloré de tanto gusto que me dio, de tanto que me han ayudado. Y pues le doy gracias a Dios, no me importa perder mi visa, pero estoy bien, gracias a Dios. Y ahorita gracias a Dios me siento más tranquila para caminar. Me siento como más segura.
I didn't know OLE Health was for everybody. It's friendly. I went in there really not knowing what to expect. I've been to a lot of doctors in the last 6 months, a lot of doctors. And I've often felt like a number, or, at worst, like just a piece of meat being shuffled along. And it's been really unpleasant. And so it's nice to go somewhere where you feel like people care. I want to live to see my children grow up. That's what I really want. That's what I want. I mean, that's my entire focus right now, is what do I need to do to stay alive?
Organización Latinoamericana para la Liberación Económica, OLE. The staff, that got involved, the volunteers that got involved, the work that was done by the community as a whole to make it happen, to me is just amazing. I'm thinking a lot of what is going to be my legacy in this community. that I love? What have I done to improve lives, to make it better for poor people? Don't you ever forget that you too are God's child.
You have to look in the mirror and every morning and you have to say, who am I? Or at least sometime during the week, who am I? What am I doing here? I sleep good at night. So many of the people that have gone through those services, when I talk to them, I see them, and it's just a good feeling.
We still have problems. We still have a lot of problems. Pero no compared to what years before. And we keep working. I mean, Luis and myself, and we're not youngers anymore. Sometimes I told Luis, ¿cómo estás? Aquí. Cuídate mucho, porque ya quedamos pocos buenos hombres. He laughed. We're never gonna give up. Never. And soon, I hope, we're gonna see this politics like a part of the history that really is gonna show this is a beginning of another chapter of this nation. I'm not afraid. We're here. And the roots are very, very deep.
We can see more people working in the wine industry now. Even owners of the wineries, Latinos. I mean, it's a lot of progress in that. But before, see a Latino owner of the winery, it was like a dream. His dream. Now it's a reality. Clinic OLE is, for me, the best that can happen in this valley.
And all start with a crazy idea, maybe. But our philosophy was that if you have a seed, una semilla, and you plant it, and you take care of him, watering, feeding him, they will grow. And that will give a lot of seeds around. Now, that's something.
Fernando, I'm the hot seat right now. Don't talk to me.
Never like to talk about myself, but sometimes I have to, I guess.
I feel like I'm completely doing a commercial for OLE Health. It's not scripted, I swear. It's true though. I mean, that's the thing. It's like I don't do this normally, but for OLE Health, I will, because I was so touched by my experience there.